Good afternoon, everyone. I'm Dr. Ashwini Singh. Since I entered the room, बहुत ज़्यादा doctor सुनने को मिल रहा है, but I am the little different kind of a doctor who's here, not the ones that you generally encounter. So, how is Synergy 2026 going? Can I hear a little bit of hooting? बहुत boring हो गया ना? Yes, nice. Okay. So, I am the kind of doctor who you would probably think is going to bore you with, medical knowledge and facts, bombard you with a lot of medical wisdom, but I'm not going to do that. I have formulated my speech in completely layman terms so that all of us can understand. It's not, if you want to read about my work, you can always visit and read. I'm not here to advertise myself. I'm here to make a little bit of a difference. So, to begin, Harshit approached me and your faculty approached me for a TEDx, and they said that the topic is what if. So what I will be speaking to you here about is what if the biggest medical breakthrough of the century has already happened. So as living in the world of science and technology, in so much of boom of innovation, we might think that the biggest medical breakthrough of this century is some nanotechnology which is going and delivering targeted therapy inside our body. Or it could be some AI-associated modality which is helping us diagnose, screen, deliver us a treatment, or probably a new drug. So we hear about drugs all the time, don't we? Yes or no? But I'm sorry to tell you, it's actually none of this. The biggest medical breakthrough happened centuries back, and it is prevention. All of you have heard of prevention? We are all hearing that prevention is better than cure. Today I'll prove it to you. So, there is a phrase, Sarve bhavantu sukhina, sarve santu niramaya. And today I'm here to speak on that only. So, let me start with a few case scenarios that I see on a daily basis, having worked in multiple government facilities as well as private hospitals. On a daily basis, I sit in a chair and I interact with people and families, children and parents who are going through extreme suffering because one person in their family is sick. We think that disease and sickness is limited to that one individual body. That body might have pain, but the emotional distress and the financial distress is with the entire family. So to quote, there was a 38-year-old man. He walked into one of my clinics and he said that I am taking drugs for diabetes, and also he was on injectables. There is a medication which you inject, it's called insulin. He was on injectables and he said, I've come for my routine follow-up. So we did an investigation, a whole body investigation, to see that the kidney of that individual was not working at its maximum capacity. Now, ideally, in such a case, the trajectory of the disease is that eventually his kidney will go into compromise, it'll go into failure, and that person would be put on dialysis. So dialysis is a modern medicine solution available to us, yes or no? So there is a solution available, but the quality of life that that individual will have for the rest of the living years is very poor. If you ever come across a patient who's undergoing dialysis, you will see they are frail, they are weak. It's a really sad state of affairs. Case number 2. A lady from a remote village of India walks into my clinic, aged around 48. That, Doc साहब, मैंने अपनी छाती में मुझे कुछ गांठ जैसा लग रहा है. Okay. So we investigate her. We do a mammography to see, okay, this breast lump is suspicious. Further, we do a biopsy and we see, oh, it is a cancerous lump. Now we ask the patient that if at all there has been similar complaints in her family. Her mother and her grandmother had died of breast cancer. Breast cancer my dear millennials and Gen Zs, is one of the most prevalent cancers across the world and in India. So what do we do next? So as doctors, we plan her course of treatment, which will include her undergoing a surgery. By that, she is going to lose something very, very feminine and intimate of her body. For a woman, her breasts. Then she will undergo chemotherapy. Post the chemotherapy, she's going to lose her eyebrows, she's going to lose her hair. And then later, she might require radiation also. Further, in due course of time, that disease would probably also spread or also relapse. Now, in this case scenario, she has already lost two very important members of her family to a deadly disease. She herself is in physical and emotional pain. She suffers from body dysmorphia, and her entire family is in emotional stress and in financial stress. Not a very good situation to be in, right? Now, last case, not going to bore you. A lady, she's postmenopausal, walks into my clinic and says that she's having a little bit of a bleeding. So, post-menopause, you don't expect a lady to have periods. When we further investigate, we find out that she has a full-blown CA cervix, which also can be very aggressive and can spread to the different parts of the body, and from there, it's a point of no return. Now, as a professional, I work in a clinic to a community setting. In a clinic, we treat disease, and in the community, we pick patterns. And the painful truth here is that we don't lack technologies, we don't lack innovation, we lack basic health awareness and knowledge. And that's why I'm here today. The basic idea of prevention is vaccines, screening, a healthy lifestyle, and health awareness, things that you hear all day, all out. I would like to address only 3 barriers here. First is the knowledge gap. As individuals of the 21st century living in this information boom, we go to Instagram and we listen to our most favorite influencers and we consume information from there. And that health information is not very accurate. And it's not going to help you anyhow. You should rather pick up your information for someone. I'm not saying you always have to pay for it. Not from Google, but from someone who has spent years studying the human body inside out, preventing and curing diseases. So we don't know what all and how we can prevent. Second is the access gap. So now, after listening to my TED talk, you know, oh, there is a vaccine for cervical cancer. Oh, there is a screening test for breast cancer. But you come from a far-flung village of Rajasthan where there is no clinic to provide you that. There is no government facility to provide you that. So how do you go about it? That is an access gap. And the most prevalent one that I come across in my patients is the trust gap. My patients and my colleagues and the people I know trust their colony neighborhood pharmacist the most. Anything goes wrong, they will go to the pharmacist. They will trust their community doctor, as in medical terms we call them quacks, the most. Or also, some auntie from some corporate hospital has gotten some surgery done and you are all listening to her stories, and then that stories becomes Chinese whisper and jargon, and we make an opinion about it. So this is where the trust gap comes, right? Now, let's come back to the cases that I quoted before. Individual number 1. That individual, his mother and father were diabetic. India is the diabetes capital of the world. If only he was told during his school days that if you tailor your calorie intake, if you take high fiber diet, high protein diet, cut down on your sugar intake, walk these many steps, drink this much of water, or go get your screening test done, as in get your blood glucose check, get your profiling done of the body annually, then probably we'll pick up the disease early or even prevent it. Then today, that individual probably would not be on dialysis. He would have a healthy and a happy life. His children, his wife, would not have the only earning member of the family, the only breadwinner of the family, sick. Case number 2. When that lady who came with the breast lump, when she probably would have taken her mother to the doctor, or the man in her family would have taken the mother to the doctor, if the doctor there, or a community health worker like an Asha, or probably a government advertisement about self-breast examination was told to her, and she was also told that this can be prevented if you get screened, then today we would not pick her up at stage 4 where the cancer has spread to her brain, her lungs, her kidneys, her bones. And case number 3. If at all that lady studied in a government school where the government of India is running a vaccination program where girls today are getting vaccinated against cervical cancer, or she went to a village in a screening camp, showed herself, and we picked up the infection at the very earliest, we would be able to prevent her cancer and she would be alive. This, ladies and gentlemen, is the beauty of prevention. So, I've put across my point. The biggest medical breakthrough of the medical century is in our hands. It is not the lack of knowledge, it is lack of action. And if today I'm even able to motivate like 5 of you to get screened, get vaccinated, and consume information from the right source, then my job here is done. Thank you so much for your time.